I'm Harold Cox, and I want to welcome all of you here. I especially want to welcome all of you back to school. I hope that you had a wonderful summer, and I'm very glad to see all of you back. I don't need to start today with just a somber note. You probably have heard about the incident that happened on the other campus with one of our students, and it's important for me to tell you about the importance of watching out for transportation and for cars. People in Boston will do what people in Boston do when they drive. It's unpredictable. Pedestrians will do what they do in Boston, and that's unpredictable. And the important thing is that you just need to be aware of where you are and what you're doing. I wish you all much safety, and I wish for all of you a wonderful school year. I want to welcome all of you now to the first of the Dean Seminars. This is a series that we hold on a monthly basis to talk about contemporary issues, and it's an opportunity for us to look at things that are important as we think about public health. This year, we have quite a lineup of activities for you. There are some things that will be on the upcoming election and on health reform. We're doing something on reproductive rights. We're doing an issue around gender identity. And they will all be interesting and informative, and we're looking forward to having you all here. I want to also suggest to you that if there are topics that you would find interesting for us to do, please let us know. We still have a few slots in the spring semester that are open for these kinds of conversations. So drop me a line and let me know about the particular kinds of things that you have in mind that you'd like for us to think about. I want to call your attention also in particular to the event that happens on September 15th, which is the first of the full-day symposia that we will be doing throughout the year. And this particular one will be looking at issues around public health in the pharmaceutical industry. So sign up for that. It will be a wonderful and engaging time as well. Today is very special for us, not only because it's the beginning of the year and the first Dean Seminar, but also because it is the official opening of the Activist Lab. Now, you know that we've talked now about the Activist Lab for a while, and the idea of the Activist Lab is that it is a vehicle to do real-world public health. When Dean Galea came in now more than about a year and a half ago, he and I had conversations about how should we do practice a little differently here at our school? What are the kinds of things that we can do to engage our school community as well as to have an impact on the community at large? And decided that what we should think about was this idea of an activist lab. You know that we have a dean who has a vision and who has a real mission of doing things differently. And this lab then is the result of one of Dean Galea's visions. The lab will have the responsibility of doing three things. We're going to educate, we're going to innovate, and we're going to advocate. We want you to be a part of the lab, and the important piece around today is that our website goes up. So the URL is up here, and I encourage you to check it out. It's an interesting website, and I particularly want to call your attention to in the website to the photo essay that Liam Hunt, one of our staff members, did entitled Faces on Albany Street. We are aware of the individuals who are on Albany and Mass Ave who are challenged with drug addictions and homelessness and mental health concerns. And we went outside and met some of those people, and Liam put together an expose that I think you will find interesting and that I know that you will be impressed by. So I commend it to you and encourage you to take a look at it. As part of the opening of the lab, we joined with our colleagues in the Career Services Office, and we just had an event in the back here that some of you participated in, which was a networking opportunity. And it was a networking opportunity for some of our students, there were about 60 or so, who were able to talk with individuals who were on the front line of doing public health, on the front line of doing governmental public health. So we had some of our colleagues from around the state who joined us, who are health directors, who are policymakers, who are doing a variety variety of different nurses who were doing a variety of different kinds of things in public health. And they were here to talk with some of our students about that work. And I'm so very pleased they joined us. And I'd like to use to see who some of those people are. And I'm going to ask if my colleagues who are from the Boston Public Health Commission and from the Massachusetts Department of Public Health, if you'll stand. Some of them are still with us now. Could you acknowledge them? Thank you so much for being here. But there are also another group of individuals who were with us for that event that I also want to acknowledge. And those are the people who are identified as being a fellow of the local Public Health Institute. Now, the Local Public Health Institute is a training institute in which we are able to provide trainings to individuals who are in state and local health departments. And to be a fellow of the institute is a very special honor because there are hundreds and hundreds and hundreds and hundreds of people that work in public health, but we have selected 25 of those individuals to be a fellow of the institute. In order to be a fellow of an institute, people have needed to identify that they've needed to demonstrate mastery of public health practice concepts. They have shown a commitment to professional development, and they've shown a willingness to be a steward for public health practice in Massachusetts. They have shown an intense commitment and dedication to their own professional development as well as to the mission of public health and good public health in Massachusetts. All of the fellows, once they are identified as being a fellow, continue to work with our institute as instructors for our courses. They serve as subject matter experts for our online services, and they provide a number of other duties in order to provide top-tier education and training for the residents and others who are the workforce in Massachusetts. So, in other words, they are the best of the best. And they are here with us today, and I want to ask them if they will also stand. Thank you. These are people who are on the front line, who are doing the work of public health, and we appreciate what they do all the time, and we're so grateful to have the best of the best right here with us. Thank you very much for joining us and being with our students today. So now about today's conversation. Conversations about marijuana are happening across the country, and they're certainly happening here in our state in Massachusetts. In 2008, we decriminalized the possession of less than 1 ounce of pot. In 2012, we legalized medical marijuana, and now we're going to be asking this year around the ability to be able to legalize the sale of marijuana for recreational use. We have a very dynamic group of individuals who are going to participate in our conversation with us today. But before they do that, we want to get a sense about what you think. So pull out your cell phones, and we're going to let you vote. So here are the instructions. You're going to text your answer to the question of, should Massachusetts legalize marijuana for recreational use? And you get to say yes, no, or I don't know. As you know, this program is also live streamed, and if there are those of you who are watching from afar, you may also participate in this poll as well. I'm going to give you a moment or two to look at this. Jim, that makes you happy. Uh-oh. Oh, okay. That gives you a sense about where our group is now. We're also going to do the same poll at the end of the session to see where you are. So keep an idea of what we are seeing right here, and we'll also check in to see where you are at the end of the session. Before we get started with our invited guests, Professor Rich Sates, who is the chair of the Community Health Services Division, is going to, thank you, is going to give us a brief overview and 10 minutes of science so that we have, so we're kind of on the same page. Rich?
Thank you, Harold. Yes, it is the Department of Community Health Sciences. Yeah. You are in that department, that's right. Yeah. Great. So I'm not here to say whether we should or should not. That's not my question, whether we should or should not legalize marijuana. I'm going to talk about what we know and what we don't know in 10 minutes, and that's why I have some notes in front of me so that I do stick to Harold's request that I give you 10 minutes. My conflicts of interest are that I approach this topic from a perspective that values health and scientific evidence. I don't use marijuana myself, although I did try it in the 1970s. It was different then, actually. I did inhale. And the drugs that I use are caffeine and alcohol, and I drink alcohol, actually, despite knowing that it's a carcinogen, so I am able to balance pleasure and risk, right? So the president said this, and it may be true, depending on the measure of dangerousness. It is true that one cannot overdose on marijuana products, although children can overdose and die. It's nice to know that maybe alcohol is more dangerous than marijuana, but that just isn't the question, or at least it isn't the question for me. So what are the questions? I'm going to just briefly say what we're talking about when we talk about marijuana, what the risks are of marijuana use, what the risks, efficacy and safety of marijuana are for health conditions, very briefly, and then what the effects have been, at least in some of the scientific studies, on legalization or medicalization of marijuana in the U.S. So what is marijuana? You can see some photos there, top left. It's dried flowers, leaves, stems, and seeds of the cannabis plant, Cannabis sativa, Cannabis indica. It's usually smoked, but now it's also vaped and eaten. It has most of the same cancer-causing chemicals and more tar than tobacco. It's usually smoked unfiltered, unlike cigarettes, and the smoke is held in the lungs longer than cigarettes, so those two things are not so good. On the upside, usually people don't smoke as frequently as many marijuana cigarettes as they would smoke tobacco cigarettes in a day. There is a more concentrated resinous form that you see in the bottom left, hashish, and there are edibles, topicals, and as I referred to before in vaping, combustible solutions. Excuse me. Delta-9 tetrahydrocannabinol, or THC, is the main psychoactive ingredient. There are more than 100 other cannabinoids that are variably present in marijuana, and cannabinol and cannabidiol, CBN and CBD, are two of the ones that we know more about. Now, these are generally not psychoactive or euphorogenic. They're not. And they're thought to provide pain relief and sedation, maybe to help treat sleep problems like insomnia. So for pain relief, you would choose a marijuana that's high in those compounds and low in THC. In other words, marijuana that does not produce euphoria. Interestingly, and I don't really mean this as a joke, but these are not among the top-selling strains if you look at internet surveys and what's being sold and bought in Colorado and California. Now, we have receptors for cannabinoids because we have actually endogenous cannabinoids. Anandamide is the chemical. The system's involved in appetitive behaviors and analgesia, and receptors are throughout the body and the brain, including the immune system. And the one message that I would take from that is mucking around with that system can probably have far-reaching effects. These are important systems. They're everywhere in the body. So we just want to understand pretty well before we do muck around with that system. Now, are there any short-term risks? In the next few slides, I'm going to just give you a summary of the literature, in my view, about the risks. So short-term, people have trouble with memory and learning. They have impaired judgment that can lead to things like unwanted or risky sex. Paranoia and psychosis can happen at high doses. And there are child poisonings, which lead to coma, seizures, and even death. The biggest short-term risk, though, that I worry about is impaired motor coordination, because that can lead to injury, motor vehicle crashes, and deaths. Unintentional injury, as you know, is already the #1 cause of death in youth. Marijuana is the most common illicit drug found in fatally injured drivers. This increased, by the way, in Colorado with the commercialization of medical marijuana. They had medical marijuana for a while, and then they started to advertise it widely, and then following that, these deaths increased. Now, what about the benefits of non-medical use? I'll talk about medical in a second, but the benefits of non-medical use. Well, there are short-term benefits: euphoria, relaxation. Now, they have been conflated with health. If you look and see in the top right there, this is a picture of the first medical dispensary in Las Vegas. And there's a general sense reflected here by Robin Williams that it's completely safe, side effects being, as he said, laughter and frosted flakes. Of note, marijuana, when he was growing up and when I was growing up, we were actually similar age, had much lower THC content than marijuana today. Now, what about long-term risks? And there's actually a top 10. So there are some. Marijuana is addictive. 9% of those who use it will develop a substance use disorder. And when I say substance use disorder, what I'm talking about is a diagnosis that's characterized by loss of control over use, interference with life activities, health, family, work, and social consequences. And to give you a frame of reference, that compares to about 20% for alcohol and 20% for cocaine. So about 9% of those who use marijuana will develop a disorder, 20% for alcohol, 20% for cocaine, 70% for nicotine. More addictive. 17% of those who use during adolescence versus 4% who would make it past age 21 and use will develop addiction to it. So the risk is much higher the younger you are. For daily users, though, it's about 25 to 50% of daily users, and marijuana is actually responsible for 17% of substance use disorder treatment admissions in the U.S., and for 56%, that is over half of those admissions in those age 15 to 19. Now, it also risks use of an addiction to other drugs. So if you look at folks who use marijuana today, 2/3 of them smoke tobacco. There's a 2 to 3 time risk of alcohol, tobacco, and other drug use disorders, and there's a 3-time risk of subsequent prescription opioid misuse in adolescents. And those are in prospective longitudinal studies, not cross-sectional studies. Now, regular use in adolescence also affects brain development. I don't have time to show you pictures of structure and function that's altered. And regular use during adolescence is associated with cognitive impairment, lower IQ, again, in prospective longitudinal studies. And I should emphasize it's regular use, and especially in adolescence. Here's the remaining risks long-term. Marijuana use is associated with poor educational outcomes and school dropout, diminished life satisfaction and achievement. Again, these are longitudinal studies. And for those who smoke it, and you don't have to smoke it, but if you use it by smoking it, chronic bronchitis, cough, wheezing, dyspnea, sick days is a risk. Psychosis, including schizophrenia, has been found elevated in longitudinal studies. And then cancer is also related to smoking it, for which there is biological plausibility in the form of histopathologic changes. These are lung cancer. The risk is increased about 2 times in one 40-year prospective cohort study, and non-seminoma and mixed histology testicular cancer, odds ratio about 2 in a population-based case control study. So these long-term risks are largely associated with regular use and primarily will affect adolescents. And of note, regular use then, since it's regular use that I might be worried about from a health perspective, has been increasing steadily, now with 40% of those who use marijuana using on 20 or more days each month. So this just describes how people are using it. It's not the occasional use. It is, I guess, for 60%, but not for 40%. And relevant to how marijuana is portrayed in society, at least among adolescents, use seems to be inverse, and this is the bottom right-hand figure, to remind me to tell you that use is inversely correlated with perceived risk. So use rises as perceived risk decreases. All right. So what about the known benefits and risks of marijuana as medicine? These are ads for medical, I know you may be surprised, but these are ads for medical marijuana in California and Colorado. People with serious health conditions, frankly, in my opinion, deserve a little bit better than this. Though if you do waiting room studies in marijuana dispensaries and clinics, what you find, and this has been studied, is a preponderance of young men with diagnosable substance use disorders. Those are not the profile of patients with conditions for which cannabis has some known efficacy. Here are some more examples. To me, these don't seem like ads for medications and treatments like we're used to. That's Colorado and California. Now, there are legal medications approved by the Food and Drug Administration as long ago as 1985 based on randomized double-blind placebo-controlled trials. The first two listed are available in the US. They contain synthetic forms of THC. They have efficacy for HIV-related anorexia, intractable nausea associated with chemotherapy, and neuropathy, as well as muscle spasticity in multiple sclerosis. So the real question is how best to study and use marijuana as medicine. Are we talking about a plant to be smoked for medicinal use? If so, which one? Which variety? With which cannabinoids, since concentrations vary? Is the least risky, most efficacious way to deliver a medication for our health is the best way to do that by finding a dried leaf and lighting it on fire and inhaling the smoke? I mean, is that really the best way to do it? If we're talking about purified and measured compounds, then which ones and how much? So there was one recent systematic review that I'll show you here. Most studies were not of smoked marijuana, and they had a high risk of bias. There was a moderate quality of evidence supporting efficacy for chronic pain treatment and muscle spasticity, and some lower quality evidence for the other four items that you see listed there on the slide. There were side effects when you do placebo-controlled trials. You find efficacy and safety. You find the pluses and the minuses. There was no evidence for efficacy for the myriad conditions you may have seen it advertised for or sanctioned in state regulations, even, apologies to the senator, even in Massachusetts. There are some, for example, one of the conditions in Massachusetts that it's sanctioned for is hepatitis C. There's no evidence whatsoever that marijuana is beneficial for hepatitis C. In fact, it's risky in people who have hepatitis C and have other risk conditions like addiction, for example. And a research letter that accompanied this review found only 17% of edibles sold in California and Seattle were accurately labeled regarding cannabinoid content. Now, as a backdrop, it's worth looking at the prevalence of marijuana use in disorders in the US during the past decade or so, when societal perception, remember about perception that I mentioned? When perception of harms has been changing along with medicalization, decriminalization, legalization, and commercialization. Use has more than doubled, and diagnosable disorders have doubled in concert with that increase, and that's predictable. More use will lead to more disorders. Now, other than the risks and benefits of marijuana itself, does science have anything to say about legalization? And the answer is not too much, really. There aren't great studies. But common sense tells us that if we legalize, it will eliminate legal consequences, like criminal records and incarceration. And that's a very good thing. But effects are going to depend on how it's done. Will ads like those I showed you be allowed? Will we continue to have marijuana as medicine without having to go safety and efficacy testing like we require of other medications? Will we be able to regulate driving while intoxicated? You should know that there are really currently no good options for testing who's intoxicated while driving like there are for alcohol. So it makes it hard to regulate in that sphere. Although studies to date can't predict the outcome, and we don't have time to sort through the conflicting literature, some of which I've thrown in bullets on this slide for later, medical marijuana has not really increased marijuana use, though it may contribute to perceptions of safety. It is, however, associated with more child poisonings in Colorado and more fatal motor vehicle crashes. That's medical marijuana. Legalization will likely lead to more new, regular, and heavy use and users, particularly among youth. And more use, as I mentioned before, will predictably lead to an increase in marijuana use disorder and its associated health risks, just by definition. So what do we know? Marijuana is not harmless. It does have risks, especially for youth, especially with regular use. But cannabinoids have some specific proven health benefits for specific conditions. We don't have definitive evidence for all the risks or all the benefits of marijuana use yet, and we don't know all the effects that legalization will have on population health. So I hope I've helped lay out some of what we know and don't know about marijuana and health, which, as we all know, is really only one part. Health is only one part, and the evidence is only one part of any policy discussion. And I hope to hear that policy discussion just about now. Thank you.
All right. So thanks very much, Rich. And I will never forget the name of the department again, the department of which I am a member of. So I will never forget this again. I want to thank you for giving us an introduction and about some of the things that we know and don't know. And I'm also very honored to have two guests with us to help us sort through this and through both some of the things that Rich has talked about, but also kind of some of the political issues as we're thinking about this as well. To my right is Jim Borghesani. Jim is the Director of Communications for the Campaign to Regulate Marijuana Like Alcohol. This is the organization that is a principal advocacy organization for the current ballot initiative. Jim is a top communications, but has held many top communication positions here in the state as well as in the private sector. In 1994, he became the Director of Communications for the Suffolk County District Attorney's Office. He also was the Director of Communications for the Massachusetts Governor's Office, immediately taking that position after 9/11 attacks. Jim's role in that office was to coordinate all of the media initiatives for the governor's office as well as for all of the state's executive agencies. Jim joined the Regulate campaign in 2015. We are also joined by Senator Jason Lewis, who represents the 5th Middlesex District of Massachusetts, which includes the towns of Malden, Melrose, Reading, Stoneham, Wakefield, and parts of Winchester. And I let the senator know that I used to live in Winchester, so I used to be one of his constituents, but not currently. He was elected to this position in 2014. Prior to that, he served for 5 years in the House of Representatives. Senator Lewis serves as the Senate Chair of the Joint Committee on Public Health and several other important committees, including the Special Senate Committee on Marijuana. And perhaps most importantly for me, or equally important for me, is that the senator has been at the forefront of passing a piece of legislation that we have worked on here and have been a part of, and some of our colleagues who are in the room have been a part of. This is the one to look at how Massachusetts public health is managed on the local level. So I want to thank the senator in particular for the work that you did in helping to pass it, and the people who are here, all of whom are in health departments, will certainly benefit from the work that you did. So thank you both very much for being here.
Thank you. Thank you.
So here's how this is going to work. They're going to talk to each other for a few moments and get to know each other. They actually know each other quite well. But they're going to talk to each other a little bit more about some things that they've been talking to each other across the state about. And then we're going to invite you to come in and participate in the conversation. So please think about questions that you have, because we'll certainly give you an opportunity to think about this. And let me just kind of start this, and then I'm going to let the two of you just have this conversation together. What's the big deal?
What's the big deal?
Yeah.
That's a good question. The big deal is recognizing that marijuana is the most widely used illegal substance in the nation, and recognizing that we have to come up with a different way to approach it. You started this by talking about traffic in Boston, and it was a good warning. You know, traffic in Boston, we have to be very careful. Let's think about what we do as a society regarding traffic. We have speed limits, we have stop signs, we have rules of the road. In the vehicle, we have safety bags, we have seat belts, we have anti-lock brakes. We have our cars inspected every year to make sure they're safe. We have regulations because we as a society recognize that driving can be dangerous. So we've taken steps to mitigate any possible tragic incidents. We can't eliminate them, but we take those steps. We do the same thing with alcohol. We have warning labels on the bottle. You know what the proof is. You know the person you're buying from. You're buying from somebody who's been inspected, or at least the distiller is inspected. You know the product. You can see it on the bottle. The people check IDs. They are licensed. They are permitted. They are regulated by the state. Let's look at marijuana. Again, it's a thriving industry in Massachusetts. It was 30 years ago, 20 years ago. It will be a year from now, no matter what happens with question 4. It's going to be an industry in Massachusetts. Right now, it's dominated by criminals. Except the medical, we're talking about social, we're talking about adult use marijuana. It's dominated by the sellers are criminals and drug dealers. We're saying, let's take the approach that we take with many other industries, and let's regulate it. Question 4 would set up an effective regulatory system. It would be licensed. People would have to be licensed to sell. They would have to apply and show all sorts of credentials about why they should be able to sell. We would have regulators, the Cannabis Control Commission, that would act just like the Alcoholic Beverage Control Commission does today in Massachusetts. They oversee the entire industry. They set regulations. They set safety standards. They make sure that people now who are purchasing marijuana don't have to go and buy a product that they don't know who grew it. They don't know who touched it. They don't know what's in it. We saw a case in Brockton just a few weeks ago that somebody bought marijuana laced with fentanyl, a deadly substance. There's no regulations in place. Prohibition and regulation cannot coexist. Question 4 looks at the reality. We're not talking about marijuana in the abstract. We're not introducing anything new to the market. We're saying what's already in the market. Let's take an approach that actually works. 80 years of prohibition has not worked. It's failed at every level. The big deal is moving forward as a society responsibly. Question 4 gives us a responsible approach to regulating, finally, and controlling marijuana in Massachusetts, both at the local level, at the state level, and it's something that, as a society, if we're responsible about mitigating danger, we should do. That's the big deal.
Well, thank you, Dean Cox. And as somebody who spends most of my time in the legislature working on public health issues, I'm just so delighted to be with you all. I know we have students, we have faculty in the room, we have public health practitioners, and it's great to spend this time with you on a very important issue. I also want to take this opportunity to congratulate you all and the Dean and Dean Galeo and the School of Public Health for the work you're doing around taking academic research and evidence and best practices and bringing them into the public domain, influencing public policy. I think that's so important, and I've seen that in my work more from the BU School of Public Health than I can say from any of our other academic institutions in the state, and I urge you to keep that up, and congratulations on the Activist Lab, which is a great initiative. So, to the topic at hand.
Thank you very much, sir.
You're welcome. To the topic at hand, I think it's very important to start the conversation, and even the polling question that was asked moments ago, I would argue didn't ask the question correctly. We need to clarify that what we're having in Massachusetts right now and what voters will be deciding on November 8th on the ballot, the same time we vote for our next president, is not an abstract debate about pros and cons of legalization of marijuana for recreational use. What we are talking about is a very specific proposal for legalizing marijuana for use and sale. That's question 4. Question 4 is 24 pages long. Just curious, even maybe by show of hands, how many people have actually had a chance to read the ballot question? Well, that gentleman is the campaign manager, so I'm pleased that he's read it. But as I suspected, virtually no one else has.
I think we had one person on this
one
side.
person
that also
and two here,
Yeah,
to be fair. And I'm not faulting you at all, because this is a very complicated issue, and there's a lot to it. But it is not, I mean, what I learned, the number one thing I learned as the chair of the Special Senate Committee on Marijuana, and I was appointed by the Senate President to serve in that role for the last 18 months, and I didn't know much about marijuana before, and I had a pretty open mind as to what would make sense for Massachusetts. But certainly what I learned, and what is written up in the Special Senate Committee's report, 118 pages, so you can read that and the 24 pages, a lot of reading for you, is it's a very complicated issue, and there are lots of public policy questions that need to be addressed. And as somebody who's passionate about public health, as I know, I'm sure all of you are as students and faculty and practitioners, I think that you should have major concern about many of the provisions that are in this ballot question from a public health perspective. And so this isn't a question of just legalizing or not. In fact, I am not opposed to legalization, but the real issue is how do we go about doing it, and when do we go about doing it? It's a how and a timing issue. And we'll talk more in depth, I'm sure, about all of these issues, but just to hit a few highlights. Some of the areas within this ballot question that are very troubling from my perspective and the Special Senate Committee and a huge coalition of health experts and school officials and law enforcement and many others. There's no restrictions or limitations around edible products. People, frankly, aren't really smoking marijuana that much anymore. More than 50% of the market in Colorado is edibles. And there are many, many public health issues with edibles in terms of understanding what you're getting, in terms of delayed reaction from THC, in terms of overconsumption, in terms of accidental ingestion by kids and pets as well. That may be the way, actually, we defeat this ballot question, is pets. Edibles. Potency. This, as Professor Sates pointed out, we're not talking about the same thing that most adults have in mind when they think about the 1960s, 70s, and 80s. This is not smoking a joint with 3% THC. This is consuming a marijuana brownie or gummy bears or Swedish fish or drinking a cannabis cola or vaping or dabbing. I don't know if anyone in the room does dabbing, but you're talking about marijuana with a potency that's in some cases approaching almost 100% THC. In the Netherlands, which has a very open-minded liberal policy on marijuana, they consider products with THC content above 15%, and the average in Colorado today is 18%. So it's already above that. They consider it to be a hard drug. They literally consider it to be a different substance that you're consuming. This ballot question says nothing about potency. Doesn't put any limits on it at all. This ballot question allows individuals to grow up to 12 plants, which is thousands of dollars of marijuana in their own home, even against the objection of their neighbors, even if there's kids living there, even if the community that they live in doesn't really want people growing marijuana in their own homes. Big problem there with feeding the black market, and we'll talk more about that because this does not kill the black market, which the proponents will like to argue. Big issues with driving under the influence. The ballot question does not address that at all. It does nothing to say how we should improve testing for people who are driving under the influence. We have nothing equivalent to a blood alcohol standard. We have nothing equivalent to a breathalyzer test, so it's very difficult for law enforcement to identify people and to actually hold them accountable. No provisions in this ballot question for doing any kind of research or baseline studies. No data. So we don't know what's the consumption rates today. What types of products are teenagers using today? How many people are truly driving under the influence? If we don't have baseline data, how can we track this over time? How can we make good public policy decisions when we don't have it? Big, big problem in Colorado and Washington because you see a lot of conflicting data coming from those states. A lot of that's because they didn't have good baseline data to begin with. And it goes on and on from there. Very significant restrictions on what our cities and towns can do. Our local public health officials will be very interested in this. Very significantly handcuffs our ability for our cities and towns to not allow manufacturing businesses, cultivation, or pot shops in their communities. The bottom line is this ballot question, again, specifically what we'll be voting on, is written by and for the marijuana industry. It's a $5 billion industry already in Colorado, California, and Washington. It's an industry that is salivating to get into the East Coast, break into New England. And they've targeted Massachusetts because we're seen as a very liberal, progressive state. And this is an industry that wants to increase consumption, that wants to normalize consumption of marijuana, that is almost certainly going to be targeting teenagers, just like the tobacco industry has done, through product innovation, through marketing with celebrity sponsorships, through advertising, through pricing, through coupons, through discounting. They're doing all of this in Colorado already. We know that teen perceptions of the harm of marijuana use, as pointed out, has declined precipitously from over 80% of teens understanding the harm to brain development to now less than 40%. A lot of that is due to changes in marijuana policy. If we were to pass this referendum and now have stores selling marijuana in all of our neighborhoods, have marijuana advertising, have price competition, have branding, these companies are all trying to establish brands and make their products more appealing, you're going to see that perception of harm going down even further. And over time, maybe not immediately, but over time, you're going to see increased consumption, increased harm to our teens, and a whole myriad of problems from that.
So please go ahead. I see you jumping at the bit.
There's so much false in what Jason just said. There's so much, and I want to address as much as I can. First of all, when it comes to edibles, we didn't give these regulators an agenda. We didn't give them limits. We took the example of how the legislature created the ABCC, the Alcoholic Beverage Control Commission. They didn't say, we're going to create you, and then we're going to tell you what to do. They said, we're going to create you, and then you're going to tell us what to do, and you're going to tell the industry what to do. We are doing the same exact thing here. Jason is using our structure, which will give regulators complete authority over what is sold, how it looks, how it is packaged, how it's marketed, who can buy it. They have total control over this. They will be answerable not to the industry, but to the treasurer of Massachusetts. So when our opponents insinuate that somehow these three regulators are going to be shills, they are insulting the treasurer, and they are not looking at the reality of Massachusetts. We have regulators who make sure the ceiling isn't falling on our head, who make sure that this microphone on my tie isn't electrocuting me. We have regulators who look at industry, not legislators, because they don't know these things. Regulators do. This structure that we are going to put in place is similar to the structure that Canada will have in 2017, a regulated and taxed approach to marijuana. Canada has decided that prohibition no longer works. Mexico, the Supreme Court in Mexico early this year opened the door to legalization there. This is something that societies are determining. Our approach must change. Now, the edibles that our opponents look at, a lot of them, and it's in their literature, they're not even allowed in Colorado anymore. Gummy bears. The senator mentioned Swedish fish. Nothing resembling an animal, a person, or a fruit can be sold in Colorado. In Massachusetts today, we have regulations on the medical side that says no edible can resemble a commercially available candy. That's where it's going to start in Massachusetts. We have no doubt that the regulators in Massachusetts will endeavor to create the most stringent product control standards in the nation. We're going to learn from Colorado and Washington and Alaska and Oregon. To say that our initiative is an industry initiative written by industry is nonsense. This is based on a bill that was filed in the legislature by two activists, longtime anti-drug laws activists or drug war activists in Massachusetts. This is based on their bill. There were no industry people that were orchestrating what was written in this bill. It just didn't happen. I was in the room. Jason was not in the room. This, again, is an approach that we need to take. It's strong structure, and we do give local officials significant control. Local officials, without a vote of the people, just by themselves, whether it's, whether the authority is the Board of Selectmen or the mayor, can limit marijuana facilities in their towns to 20% of existing package store licenses. So for instance, if a town has 10 package stores, Selectmen, on their own, can say we'll have no more than 2 marijuana facilities. By a vote of the people, a ballot vote, communities can prohibit marijuana facilities altogether. It's a ballot vote that occurs all the time in Massachusetts for Proposition 2.5 overrides. For other local initiatives, you get a percentage of people to sign an initiative request, and it gets on the ballot. We have significant control for local officials. In fact, Jason and I and our campaigns both participated in what's called the Citizens Initiative Review. It took place a couple weeks ago. A very detailed, structured program where 20 citizens heard from both sides. They heard from experts, economists, drug control specialists, treatment specialists, people from Colorado, people from Oregon, who could testify about what is happening in their states. They had 5 key findings that they could look at. They could have chosen anything. They could have chosen that edibles are too dangerous. They could have chosen that use among teens is going to go up. They didn't use a single message point from our opponents, not one. The first message, the key finding that they had, was that this gives significant control to state regulators and to local authorities, which is exactly what's needed now for the marijuana market in Massachusetts. So our opponents their whole campaign has been built on fear and scare tactics. It's the same as in every other opposition campaign in the other states. This is the playbook. They try to ignore the reality that marijuana is in the market now. It's uncontrolled. It's a dangerous market. You're putting buyers into the embrace of people who sell not only marijuana, but heroin, OxyContin, other dangerous drugs. By definition, you are sending 880,000 people in Massachusetts, and that's a figure from Jason's report, probably the only correct figure in that report. There are 880,000 regular users in Massachusetts. We are sending them into dangerous markets, and it has to stop. We have a significantly strong structure that is in question 4 that will address all of the failures of the current market.
So you obviously don't agree with each other.
Can I just respond to some? Because some of that is just
but before you do
patently false.
Yeah, I know you don't agree
it's
with each other.
Really,
but I want to make certain that we're kind of clear about where we're going in the conversation. The first thing I think that I've heard you say, Senator, is that the use of marijuana is actually not your major concern, but that the structure of the ballot initiative that has been put forth. So before we go further, could you explain to folks exactly what it means to have a ballot initiative and how that process works so that we understand the mechanism that we're talking about?
Absolutely. I mean, it is something we have in Massachusetts, which we can debate the merits of that, and that is a citizen referendum ballot process. Some states don't have that, and basically, if a group of citizens, gets enough signatures and meets some other requirements, they can basically put a proposed law on the ballot. And once we all vote on that, that then becomes the law of the land.
So this is binding.
So this is binding. This is has the same effect as if the Senate passed the bill, the House passed the bill, and the governor, Governor Baker had signed it. And that is a very, very big deal. And it is probably there are different perspectives on the merits, pros and cons of ballot initiatives, but there are certainly some questions I think that are probably pretty straightforward. I'll give you an example in the public health world that I think is something like assisted suicide. Whether people should have the right to take their life when they're when they have a diagnosis that they have a limited amount of time to live. That maybe is a good issue for the public to sort of decide. But there are other issues like marijuana and this whole complex issue of how you legalize it and how you regulate it and how you set all these policies. That's a very, very complicated thing. And it's probably almost certainly the case that most people out there, even educated voters who try to educate themselves are not going to read all 24 pages of the ballot question. It's just, they don't have time to do that.
So let's see if we can kind of...
very difficult thing. But can I just say, in terms of that ballot question, 24 pages, it is so disingenuous for Jim to say, this is pushed by activists. I think it's true that for many decades, social justice activists, people like Dick Evans, who is part of this steering committee, were trying to change our drug laws. And for good reason, because we were throwing people in jail, arresting them and throwing them in jail, for just simply possessing a joint or something like that. And I absolutely don't agree with that. And one of my objectives as a progressive Democrat in the legislature is to change our criminal justice system, to eliminate mandatory minimums, change our bail laws, provide better reentry for people. But that's not the issue that we're debating here. We have already decriminalized the possession of up to an ounce in Massachusetts since 2008. An ounce is about 50 joints, so just to give you a sense. The police are not arresting anyone for possessing or using marijuana. That is not the issue. That is not the issue at stake here. So the activists were pushing that, but today, what has changed is this is now being pushed by an industry. Stands to reason. This is an industry that is growing rapidly in the West Coast, $5 billion industry. The Marijuana Policy Project, which is the group that is behind this ballot initiative, and what tells you that it is being driven by the Marijuana Policy Project in the industry is they filed essentially the same ballot question in 6 states. So the same, literally almost the same question is being on the ballot in Massachusetts in November, as well as Maine, Arizona, California, and Nevada, I think, one other state. They even have the same name. They act to legalize and tax and regulate marijuana like alcohol. It's the same playbook. The Marijuana Policy Project has been increasingly taken over by the industry. It's the members of that board are CEOs of marijuana businesses, the CEO of ArcView, which is the leading investment firm in marijuana businesses. In fact, where Jim's office space is for the campaign is Forefront Ventures, which is a local firm that consults to and invests in the marijuana industry.
So let's
be clear about who's behind us.
Let's be clear about who the CEO, hold on. Let's be clear about who the CEO of Forefront Ventures is. His name is Chris Crane. Listen to this. Now, this guy, his name is Chris Crane. Let me tell you how he got into the reform business, if you will. He started as a student. He joined Students for a Sensible Drug Policy. He was committed to changing drug laws in the country. He became president of Students for a Sensible Drug Policy. This has been his burning desire ever since he was a freshman in college, to change drug laws. So to somehow indict him for donating office space to us, I think is absurd. Here's a guy who, frankly, is doing the right thing as far as I'm concerned. And to say that somehow it's sinister that he would house a campaign, it's just, that's unfair.
Jim, I didn't say it was sinister. What I said was
that... You implied it.
No, I didn't.
Yes,
Don't put words in my mouth, please. What I said was that the people behind this ballot initiative have a profit motive. That's fine. We're a capitalist society. I'm a graduate of Harvard Business School, so I have no problem with capitalism. But when you care about public health, and you care about public safety, then there are certain industries which are predatory industries. We understand this with the tobacco industry. It's a predatory industry. The alcohol industry, in many ways, is. The gambling industry doesn't mean that those industries we're going to go back to prohibition. I'm not advocating that at all. But what I'm suggesting is, why don't we learn a lesson from the battles we have fought in the trenches with the tobacco industry, trying to protect our kids, with the alcohol industry, with casinos, and let's be smart and take a different approach to how we deal with marijuana. Rather than passing this ballot question, opening up the state to the marijuana industry, there are more pot shops now in Colorado than there are McDonald's and Starbucks combined. That's an approach that we could take. It's a capitalist approach to marijuana. Let them go at it. Yes, we would regulate the industry, and we would try to, but it's very, very difficult to put the lid on an industry like this once they get a foothold. They will fight you tooth and nail. Or we could take a different approach, and we could look at other ways that you could make it safe and legal for adults to consume marijuana without creating a commercial industry and marketing and pushing and promoting.
So the legislature had the chance to do that. Jason had the chance to do that. After the people of Massachusetts voted overwhelmingly to decriminalize marijuana in 2008, that, to me, should have sent a message to our legislators who said, we have to take this serious. Jason, you did nothing. Your colleagues did nothing. After 2012, when the voters of Massachusetts some of you perhaps, voted overwhelmingly to create the medical industry in Massachusetts. Again, why didn't the legislature say, we see which way society is moving, we're going to get ahead of it. We're actually going to lead, not follow. Not only did they not follow, they didn't do anything. There was nothing. The bill that our initiative is based on languished on Beacon Hill. Jason can say all he wants about how we need a different approach. He and his opponents are proposing nothing. Nothing. We are proposing this initiative, which again, yes, it's similar to other states. Why is that? Because it works. It's the most responsible way to approach the marijuana markets in those states, which are thriving, which is illegal, which are dangerous. That's why similar ballots are on in other states. That's why Canada is adopting the same approach, because it's responsible. It addresses the issues of regulation, and it does it in a way that's accountable to the public. You know, we don't want the legislature now to step in and say, you should do it our way, when they've been doing nothing all along. It's too late. They had the chance. Now the people of Massachusetts can look and say, yes, 80 years of prohibition hasn't worked. It hasn't prohibited anything except our ability to put safe regulations in place to finally control a market in Massachusetts that right now is dangerous, is unregulated, is unsupervised, is dominated by criminals. If question 4 fails, the same system will be in place. Jason can talk all he wants about what should be done. He is proposing nothing to change that system.
First of all,
we are.
Jim, first of all, there are different approaches. The Netherlands has a different approach. Let me finish.
One,
Spain
Jason.
has a different approach. Uruguay is proposing a different approach. Washington, D.C. actually has a different approach from the other states. And we don't know what Canada may or may not do. So there are different approaches, and we should take the time to learn from all of these and do the smart thing in Massachusetts. Second of all, we have not been sitting on our hands in the legislature. That's exactly why a year and a half ago, the Senate formed a special Senate committee on marijuana. And believe me, I've been spending more time than I ever imagined I would spend on this topic, studying it, researching it, spent a week in Colorado, talked to people in Washington State, really have dug in to try to learn about this. And third, it is, and Jim understands this, he's trying to pull one over on you, just filing a bill and getting maybe 10 of my colleagues to co-sponsor it does not constitute working with Beacon Hill to pass a law. It's just not how things work. There's 5,000 bills that are filed every legislative session on Beacon Hill, 5,000. Now, even if you take out the ones that are, sick leave banks and not controversial at all, you're still talking well over 1,000 bills that deal with healthcare policy, education policy, transportation policy, economic development, many different things. The way legislation gets passed is people who care about that issue have to put in the time, the effort, the labor. They have to come to the legislature. They have to educate lawmakers. They have to organize. They have to work with us, form coalitions. None of that has been done by the marijuana industry.
So,
in fact,
can
I say one thing? Before this debate began, can I just say just one point, because I think this is helpful. Before this debate began, I never had one constituent or one marijuana activist ever come and see me about
Did you not
policy.
have a gentleman who represented
not
Christians against prohibition come visit you, Jason?
That's true. That one gentleman did. So I stand corrected. One person who is for getting rid of any restrictions on any drugs whatsoever.
Gentlemen.
That's true.
Gentlemen.
But not one. It takes hard work, and that's not what they've done. And the industry purposely doesn't want the legislature to do this now because they don't want these kinds of restrictions on edibles, on home growing, on other sensible restrictions. They want to do it their way.
Gentlemen, so one of the things I actually said to them is that I didn't want to talk. I didn't know that was actually going to be the case. So,
but watch out what you wish for.
This is exactly what I wanted. So, but I do need to invite people from the audience to come in and participate as well. So, but let me see if I can say what I think that I've heard you say. Is that from the perspective of Jim, there is a right, there's a need to put forth a regulation that will address a concern. From the perspective of the senator, there is concern about the particular policy that has been put in place, that it raises for you a number of issues around potency, edibles, and the like. There's clearly a great deal of disagreement among both of you about what this policy will do and the impact that it will actually have on the have I summarized? This is a yes/no question. Did I summarize that kind of correctly?
I think you did a good job.
All right. So
Excellent job.
I want to see if there are people in the audience that would actually like to contribute to our conversation, and we'll. Okay, there you go, right here.
Can I suggest you limit our answers to 30 seconds each?
I could suggest that.
Because he will try to dominate, because that's what he does.
Yeah, I'm going to suggest that, but we've seen what that works. Okay. I think we need to use the mic so we can capture it for people who are listening.
Okay. I apologize. This might be kind of long, but I was given the
And I'm going to ask you also to keep it short as well.
I mean, it's a long question, I guess. I was able to talk to a canine police officer, and he indicated that a lot of the canine drug dogs are actually detecting marijuana as well. So with the legalization of recreational marijuana, that those drug dogs would basically be useless due to the poisonous trait if they do detect marijuana and then happen to detect other controlled substances. So how do you think that the legalization of recreational marijuana will affect the detection and basically, I guess just the detection of other controlled substances and leading to the bigger busts, since most cops, at least this cop that I talked to, didn't really care about marijuana. They just cared about the other controlled substances. Do you think that would have a major effect on controlled substance finding?
So how do we think that legalization will affect the ability to detect other illegal drugs? Is that what you mean?
Yes. He was stating that most of the time that they found marijuana, they did find other harder drugs such as opioids.
Yeah, well, that's what I said to you. The people that deal marijuana now do have other more dangerous drugs. We want to separate that market, the marijuana market, from the deadly opioid market. Now, you know, the dogs that detect marijuana, maybe they could possibly be put to use with interstate commerce, perhaps, because right now that's illegal federally. One thing I think would help, it would maybe give the police a greater ability to detect more dangerous drugs, because they wouldn't have to spend resources, which they are now, on marijuana arrests and marijuana investigations, because people are being arrested. Last year in Massachusetts, there were 3,500 arraignments for Class D substances. That's marijuana. So the idea that people aren't getting arrested anymore is just not true.
I just have a quick question on that one.
That's just
Is it
false.
federal
That's just patently
who's
false.
being, is
So-
it federal regulation or state that they're being arrested on? Like which
They're
set of laws?
They're not being arrested in
They are being
They
arrested.
are. First of all,
They are.
less than an ounce is civil violation, and people don't even get a penalty. And more than an ounce, and again, which is you're getting into fairly large quantities, would still be illegal under this ballot question. There are a small number of people that we, in the Senate committee, looked very closely at all the data. We collected it from all the courts. There are a small number who do get charged with Class D, and it's almost always because they're arrested for a different violation. They're arrested for possession of another substance. They're arrested for breaking and entering or assault. And then there may be a charge added on, again, if it's more than an ounce, which would still be illegal. So this is not about the criminal justice system. Our law enforcement doesn't spend virtually any time on marijuana, as you rightly pointed out. And the other thing to note is this is not about getting rid of the black market. The black market is thriving in Colorado. You may have just seen the front page story in the Globe the other day on that. I talked to law enforcement out there. I've talked to their attorney general. It's thriving for two reasons, because first of all, there's so much money to be made in pot that there's a big incentive to still be out there and undercut the legal market. Allowing people to grow at home creates an enormous loophole, because it's easy to grow plant. It's a weed. One plant will generate about a pound of marijuana worth $5,000 on the street, so very easy. And the other problem is this is illegal under federal law, which means that now there's this big incentive to take advantage of the legal market, let's say in Colorado, and this would be true in Massachusetts, and then use that as a base to supply surrounding states as well. So it is probably hurting Mexico. It's moving it out of there into Colorado, into California, and it will move it into Massachusetts. By the way, because of all these reasons, law enforcement is, in its entirety, is opposing question 4, as are the doctors, the Mass Medical Association, as are pediatricians, as are mental health practitioners, as are addiction specialists, as are superintendents in our schools, as are nurses, as are business leaders. They're all come out publicly opposing question 4. It's a unprecedented bipartisan coalition that has come out against this question.
All of those same groups opposed decriminalization in 2008. All of those same groups, every single one, opposed medical marijuana legalization in 2012. Every single one of them. So the fact that they're trying to make this unique coalition, they've been opposed to every binding marijuana initiative that's ever been on the Massachusetts ballot. So it's not a unique coalition. By the way, Colorado figures, sales arrests in Colorado in 2015 dropped by 25% compared to pre-legalization 2012, which was the last year of non-legalization. Sales arrests down 25%. Arrests for production, growing, producing marijuana, down 25%. So it has made a significant impact in the illicit market in Colorado. You can't have more than $1 billion in sales and not impact the existing market. It's just impossible.
Let's see, we have another question.
Quick question.
Okay.
In Sweden, alcohol is sold in government-controlled stores that the reason that they set it up was actually primarily for health, not for profit.
Yes.
I'm wondering about whether you think that model might work in the U.S.
Yep. So if I could take that, I really appreciate that question, because that's the kind of thinking and the discussion that we should be having, which is, yes, there are roughly 700,000 or 800,000 adults in Massachusetts who do use marijuana from time to time. That's probably not going to change. So let's really figure out how do we then ensure that if that's going to be legal, that it's safe, but that we don't create an industry that is going to be driven by profit to promote sales and consumption and grow that industry. And having a state-run supply chain could be one way to do that. We do that with the liquor industry here, like in New Hampshire and some other states. The problem is that's only the retailers that are state-run. The industry still creates the products and brands them and markets them, so it doesn't really have much of an impact. If the state ran the entire supply chain, you weren't creating Wiz Khalifa Kush and all these other brand names, that the industry would market, and it was just you had some, sort of plain vanilla lines of product that adults could get access to legally and safely. That could make a big difference. There's also the model of having cannabis collectives or clubs, which Spain uses, where you have the right to come together and produce and consume marijuana, but again, it doesn't get commercialized, and that does ensure a safe product without commercialization, so that's an interesting model. Our medical marijuana in the state is a nonprofit system. It's not perfect either. None of these options are perfect, but that's also a way to kind of take the profit motive out of it and to really try to prioritize public health. That's another approach we can look at.
Our time is we are very close to our time, and I'm sorry, I'm not going to have time for more questions. I have just one question for both of you, and this requires a short answer. So there is a ballot question. And I'm wondering if you can give the rationale give a reason for why people should vote against it or why people should vote for it. But I need a short answer, because then we're going to do our ballot again. And this is a conversation that we will just need to continue again. But can you give us the reason why someone should vote against it and why someone should vote for it?
Who do you want to go first?
Why don't you go first?
Okay, thank you. So this ballot question, question 4 on November 8th, is not about whether adults can use marijuana. They can already in Massachusetts. It's been decriminalized since 2008. No one really bothers an adult if they're using marijuana in their own home. This is not about therapeutic benefits of marijuana, because we have a medical marijuana program, and yes, it's had problems, but we should work on fixing those and expanding access. What this ballot question is about is whether we're going to open Massachusetts up to a profit-driven billion-dollar commercial marijuana industry to get into Massachusetts to develop and promote and market their marijuana products, increasingly, which are highly attractive edibles, very attractive to teens, high-potency products with much more serious health risks, allowing home growing, putting serious restrictions on our cities and towns to have control over this, and in general, leading us down a path that is not good for public health and public safety.
Thank you. Jim?
What this question is about is recognizing reality. Again, recognizing that the market in Massachusetts exists now, and we as a society should finally do something to regulate it and bring it under control. It is not a safe market. We need an approach that actually works. This is not about an industry that wants to come in and make money. This is about a system that has failed across the board. It has done nothing to prohibit marijuana in the market. We need a system that actually does address regulation, does address safety, takes an approach that the state takes to all other industries, that mainly we want to make the people that participate in this industry and the product that's produced by this industry, make them as safe as we possibly can. Again, if question 4 fails, we have the same system in place. We're not introducing anything new to the market. We're saying, let's come up with a system that actually works, that will regulate the market as it exists now, that will help put criminals and drug dealers out of business. And that will, by the way, one thing we haven't talked about and we don't stress, will generate more than $100 million by the year 2020. And that $100 million could be used, that's just in tax revenue, by the way. That $100 million could be used for a lot of things. Beds for opioid treatment, public safety programs, public education programs. We're seeing cuts right now, $1 million cut, $300,000 cut for opioid beds in Hampden County. This is the big issue for the governor. He cut an opioid task force in Hampden County, $300,000. These are the sort of cuts that we're making now. We're in a budget crisis. Our $100 million, that's a tiny portion of the Massachusetts budget, but it would cover a lot of the cuts that the governor has recently made, some of which were overturned by the legislature, but this would go a long way into addressing, this is absolutely true, it would go a long way into addressing some of the needs that we have now, particularly the need to increase treatment beds.
So we're going to take our poll again. Joanna, could you put the poll up again?
I'm going to have to talk again.
Is it possible to have the question be whether we should vote for or against question 4? Given the debate we've had about legalization, there's different approaches.
Yeah.
I wonder if it's possible to clarify that.
So how would you want to state the question?
Whether should Massachusetts voters pass question 4 in November? Is it possible to ask it that way?
We can change the question.
I think everyone hopefully understands at this point that there's a
All
difference.
right. So, but I want to make certain that we're clear about what we're asking people to vote for. How would you restate the question?
If you don't mind, if you'd indulge me, I'd suggest the question would be very interested to hear from you all is, should voters in Massachusetts pass question 4, ballot question 4, in November?
Jim, are you okay with that modification?
I think we should be consistent. We started with this question. You know, either way, I don't care.
I mean, that's what we're voting on.
So I actually, just because we started with this particular question, we understand that the senator certainly disagrees with this, and we've heard their perspectives. But let's stay with this particular question for right now, understanding that the senator is certainly is opposed to the way we have framed the question. So are you okay?
I wouldn't say I'm opposed. I'm just suggesting.
You're suggesting. Okay.
I think a lot of people are going to vote. They've heard it. They'll vote either way.
Okay, you can take that into consideration.
But you should look at how this is changing. Ooh, it's still moving. Come on. Senator, I think you had an impact on the conversation.
Well, I appreciate everyone paying such close attention.
Oops. You wanted to stop right there, right?
Is that Will voting multiple times?
Well, here we go. This is where we are right now. Wow. Clearly, this is a conversation that we will continue. We will see what the voters have to say. I'm so very glad that you were able to join us. Please thank our guest.
Thank you.